In the previous videos, you have really discovered what are the diagnostic criteria for ADHD. And in this sequence, we are going to cover what are the assessment and tools that we need to do if we suspect a diagnosis of ADHD. My name is Maud Schneider. I'm a child and adolescent psychologist specialized in the field of neurodevelopmental disorders, and I work at the University of Geneva. So the first step of an assessment for a possible diagnosis of ADHD is what we call the medical history. We are first going to ask the person what are the main symptoms and difficulties in the daily life. We are also interested to see if the suspicion of this diagnosis of ADHD was made by the person himself or herself, or if it was mentioned by another person, for example, a teacher. Then we are going to ask several questions about the history of the person. The developmental history, for example. We are also going to ask about possible other diagnoses that are present, possible pharmacological treatments, the professional, the educational background, the family history, all those information that are really important to, at the end, decide whether the diagnosis of ADHD is present or not. As you have seen in the previous videos, the diagnosis of ADHD is a clinical diagnosis. It means that it is based really on the collection of several signs and symptoms that must be frequent and present at a certain intensity. So really the basis of the assessment is the clinical assessment. The recommendation is that a semi-standardized assessment is performed, which means that the person is going to really cover in detail all the different symptoms of ADHD to see whether the symptom is present or not, and whether it is present at a sufficient intensity and in different contexts. There are several tools that have been developed to really help with these semi-standardized procedures. And the type of tool really depends on the age of the person that is assessed. For children and adolescents, one of the most well-known tools is the KSADS. It's a semi-standardized assessment that really covers all the psychiatric diagnoses, for example, mood, anxiety disorders, and there is also a section on ADHD. There are several questions of screening, and if the patients check some of these questions of screening, then there is really a more in-depth assessment of all the diagnostic criteria. There are also some tools that have been specifically developed for ADHD. For example, the ACE interview, the ADHD Child Evaluation Assessment, and this is a tool really that specifically targets the diagnosis of ADHD. In adults, there is also really some tools that can be useful for the assessment. One of the most well-known tools is the SKID, and in the latest version there is also a section on ADHD, and it also covers a breadth of possible diagnoses ranging from mood to anxiety, but there is really a section on adult ADHD. And then there is also the adult version of the ACE interview, which is called the ACE Plus, that is also developed specifically to assess ADHD. And finally, there is an assessment called the DIVA-2, which is also an assessment that is specifically targeting ADHD in adults. So really, this is really the basis of the assessment, is this semi-structured interview. Then there is the possibility to also use self or other reported questionnaires that can be also useful to quantify the intensity of symptoms. Because during the clinical interview, the aim is really to define whether the symptom is present or not. So it's more like a dichotomous answer. Is it present or is it not present? But with the questionnaires, you can go a bit more fine-grained into the intensity of the manifestations that are present. Again, there are several tools that have been developed and that can be used depending on the age of the patient. In children and adolescents, the most well-known questionnaire is the Conners, which really targets all the different symptoms of ADHD, as well as associated manifestations such as oppositional symptoms or social difficulties with peers. There is also the brief questionnaire that is less focused on the symptoms of ADHD, but that more targets the executive dysfunction in the daily life. So this questionnaire can be really useful when we want to target something with an intervention to see what is really difficult for the person in his or her daily life. For adults, this is the same. There are also several questionnaires. The first questionnaire is the ASRS, the Adult Self-Reported Questionnaire for ADHD. And there is also another questionnaire called the WURS, the Wenda-Uta scale, that is also targeting ADHD symptoms in adults. International guidelines really recommend to have what we call a multi-informant assessment. It means simply that when you do a diagnosis of ADHD, you should not only ask the person himself or herself, but also people around the person. So it can be a parent, it can be the teacher, and it really, again, depends on the age of the patient. The multi-informant assessment is really important because it helps us to determine whether the observations that are made are similar in the different contexts and whether the symptoms are also present in the different contexts. Because, as you may remember, this is one of the requirements for the diagnosis of ADHD, that the symptoms are present in more than one context. In some cases, there is also what we call anosognosia, which means that the patient may not be really aware of the difficulties. This can be the case, for example, in young children who do not necessarily realize that they have attentional or hyperactivity or intentional symptoms or hyperactivity. And this can be also present in older children. For example, when there are a lot of compensatory measures that are put in place by the parents, for example. And in this case, sometimes it's difficult for them to really perceive how much the symptoms interfere in the daily life. So in this way, the multi-informant assessment is really useful to really determine what is present and what causes interference in daily life. If you assess young children or up to the age of 12 or 13, I would say that the main informant is really the parents. So this is the person who is going to give the most information about the symptoms and the interference in the daily life. Of course, it's very important to see the young person, to observe potential symptoms of ADHD during the interview. And it's also mandatory to hear whether the complaints, potential complaints of the patients about the symptoms. If possible, it's also very useful to ask the teachers about possible symptoms in the school setting. And I mentioned before several questionnaires, and it's important to know that some of these questionnaires are available as a teacher version, so it can be also a useful way to structure the collection of information with the teacher. In older teenagers, the first line of information is really the person herself, so it's important to really ask the symptoms in a standardized way. If the parents are available and if the young people is willing to have the parents present during the assessment, it's of course very important to have the report of the parents and of the teacher as well. For adults, the situation is a bit different. So of course the first line of information comes from the patient himself. And then if the patient lives, for example, with a partner or with a relative, it's important to gather some information from these people as well. And as we do not have always information about the professional context, one very important information could be to ask for the school records, for example, when the person was younger. Once you have done the clinical assessment for the symptoms of ADHD and potentially use some questionnaire to quantify the intensity of the symptoms, strictly speaking, it's possible to stop there for the assessment. However, what is done usually is also a neuropsychological assessment or a cognitive assessment to really assess in depth the attentional function and the executive function. This can be done with computerized tests or a paper-pencil neuropsychological test that can really help to determine the profile, the cognitive profile of the person. This is especially relevant when you want to put some intervention measure or accommodation measures that we will see in the next sequences. And this can give really a baseline of the functioning of the person. And finally, one last step that is often necessary is to determine whether there are also other possible diagnoses present in the same person, or whether the symptoms can really be put on the account of another diagnosis. This is what we call differential diagnosis, when we want to really disentangle if the symptoms are really part of an ADHD disorder, or whether they can be put on the account of something else. And also, ADHD often does not come in isolation, and there are also other difficulties present. This is what we call comorbidities. And in some cases, it's very important to really cover all the other possible diagnoses that are present as well. But we will see that more in detail in another sequence. So in this video, we really have covered the process of the clinical interview for a possible diagnosis of ADHD.